Hi friends. Now we have initiated a series on YouTube and Damseli page on Facebook called as Unplugged, where we discuss common clinical cases, sometimes some uncommon case, sometimes a X-ray, sometimes a pathological image, and we try to help you to correlate them with a multiple choice question here. Now today what I am doing is I am going reverse way. I am going to show you a chest X-ray. And I am asking you what is the diagnosis in this X-ray. Usually sometimes as a radiologist I see this X-ray in my routine practice. What do you think is the outstanding features? So now if I try to look at this X-ray here and I see, if you compare the right and the left thorax, can you see the right lung is smaller than the left? That is the first outstanding finding. Then second outstanding finding that I see is the right cardiac border looks a little blurred. It's not as sharp as the left one. So you can see there is and if I also notice the mediastinum looks to be shifted towards the right. So there is some element of volume loss in the right lower lung. I hope we are all agreeing here, which is leading to a resultant mediastinal shift. There is some blurring of the cardiac border which is evident on the X-ray so far. Then when we take a closer look, can you see this curvy linear structure going from the right lower zone, going subdiaphragmatically and curving, and by the time I reach downwards it looks to expand. It is narrower at the top and it expands here and is going towards it. Now what could it be? Now this is a case of partial anomalous pulmonary venous connection, and this vein is called as the Scimitar vein. Scimitar is the Turkish sword. This sword, like a kripan, would be narrower at the base and then towards the end it becomes broader. So what exactly is happening here is, now we all know about something called as total anomalous pulmonary venous connection, where the pulmonary veins, they form an anomalous vein and drain into the right heart. Instead of the left heart, they are draining into the right atrium. That is TAPVC, and we all have seen as an undergraduate X-ray showing you a figure of 8 or a snowman heart in a TAPVC. This is partial anomalous pulmonary venous connection, where the right lower lobe pulmonary vein is draining subdiaphragmatically into the systemic vein. Systemic vein like inferior vena cava, probably it must be draining into the inferior vena cava. How to confirm all this? So we can do a CT scan of the chest or a CT angiography, and we can try to make an oblique coronal reconstruction, where you can see the anomalous vein, and can you see how it becoming broader when it reaches down and draining into the inferior vena cava. This is how a partial anomalous pulmonary venous connection or a Scimitar vein or Scimitar syndrome looks like. Now this person usually might be asymptomatic, but in effect if you look at it hemodynamically, it is a pulmonary to systemic shunt that is happening. This is a left to right shunt that is happening. So if the left to right shunt is significant, the patient might have symptomatology, and if it is a significant left right shunt, it might ultimately lead to a pulmonary arterial hypertension in long-standing left right shunt, and it might lead to Eisenmenger syndrome. And that is, if it is a significant shunt, you will actually, these are the patients where you look for surgical correction as well. You put an interatrial baffle, or you redirect and you reposition the vein back into the left atrium. These are the possible surgical options in this condition. So if I summarize again, this is what is a Scimitar, or the vein, that is what is the shape of this vein like, and this is called as the Scimitar sign on a chest X-ray, which is a very important potential MCQ for you. So final diagnosis in this case is either we might say Scimitar syndrome, but I also want you to know it is synonymously called as partial anomalous pulmonary venous return syndrome, also called as hypogenetic lung syndrome. And you saw how the right lobe was hypoplastic because of the anomalous venous drainage. Interestingly, it has been found to be associated with, sometimes these patients have abnormal systemic arterial supply also. So they might be associated with pulmonary sequestration. And they are also associated with congenital heart disease, is also one of the important associations to keep in mind when you see such an X-ray in your day-to-day practice. And I hope you enjoyed this interesting case today on the Unplugged. Do follow us on Damseli channel on YouTube or Damseli page on Facebook for more such videos, and do write back to us if you enjoy this Unplugged approach by DAMS. Thank you.